Imagine looking at your own baby and knowing exactly what they look like, but genuinely believing that it isn't your baby. That sounds impossible, but there's a phenomenon called Capgras Delusion, where someone believes that a person they know has been replaced by an identical-looking imposter. And yes, this has actually been documented in postpartum psychosis. I want to talk about one case because it gives us a really unusual look at what postpartum psychosis can actually look like. A 26-year-old woman developed psychotic symptoms after giving birth. On the third day postpartum, her baby developed jaundice, and she became increasingly distressed. She began saying that a witch was going to take her baby. Over the following days, her behavior became increasingly disorganized. She was crying, throwing away clothing belonging to herself and her baby, muttering to herself, staring at family members, and behaving in ways that were very different from her baseline. By the time she was hospitalized, she was experiencing multiple psychotic symptoms, including persecutory delusions, auditory hallucinations, ideas of reference, and Capgras delusions. Capgras is a type of delusion misidentification. The person can recognize the familiar face, but something about that person's identity or familiarity feels profoundly wrong. Their brain still has to explain that discrepancy, and in psychosis, that explanation can become a fixed belief that the person has been replaced. In this case, those beliefs centered around her husband and her baby, with the belief that they would be taken away by the witch. And I want to pause here because this is very different from having an intrusive thought. A postpartum parent might have an intrusive thought like, what if someone takes my baby? Or even, what if my baby isn't really mine? The thought can be horrifyingly precise because the person recognizes it as a thought that doesn't make sense and doesn't fit with what they actually believe. A delusion is different. The problem isn't simply that a frightening thought occurred, reality testing has become impaired, and the belief can be experienced as true. That distinction matters because postpartum psychosis is an emergency. It isn't just severe anxiety, it isn't just being overwhelmed, and it isn't synonymous with postpartum depression. It's also why I don't think we can rely on the idea that psychosis will always be obvious to everyone around the person. Psychosis can involve profound changes in someone's interpretation of reality, while other parts of their behavior may still appear familiar. This woman had a previous psychiatric episode after losing a pregnancy, and she had stopped taking olanzapine several months before becoming pregnant. She also developed symptoms very quickly after giving birth, and that matters because postpartum psychosis often has a rapid onset, and the postpartum period can be a period of significant psychiatric vulnerability, particularly for people with an underlying bipolar spectrum vulnerability or previous episodes of severe mental illness. And I think cases like this are important because postpartum mental health symptoms can get minimized so easily. She just had a baby. She isn't sleeping. She's anxious. She's overwhelmed. Those things can be true while something much more serious is happening underneath them. If a new mother is experiencing hallucinations, delusions, marked disorganization, severe confusion, or a significant loss of contact with reality, that isn't something to watch and see if it gets better. That's a psychiatric emergency. And postpartum psychosis does not mean that someone is destined to hurt their baby. Most people who experience it do not. But the risk of suicide and infanticide is elevated, which is exactly why recognizing it and getting someone appropriate psychiatric care quickly matters so much. Because sometimes the most dangerous part isn't that someone is behaving strangely, it's that the people around them don't realize how far their reality has shifted.